Hi Marinus, this is Mohan Das. With the EFA MFA exit exam questions and answers set number 3, June 2023. Question number 1. What symptoms would indicate internal bleeding? A. Rapid weak pulse, excessive thirst. B. Skin that feels cold or moist or look pale or bluish. C. Tender, swollen, bruised or hard areas of his body such as abdomen. Answer D. All of the above. Question number 2. Your role in making the first aid successful work effectively includes 4 steps. Answer: recognize, decide, call, provide. Question number 3. A lung is an individual organ composed of tubular structures and alveoli bound together by fibrous connective tissue. Answer: false. Question number 4. To flush an eye that has been exposed to a chemical, have the injured eye lower than the unaffected eye. Answer: true. Question number 5. An unconscious casualty is lying on their back and has a broken leg. What position is best for the casualty? Answer: lying down with the legs raised. Question number 6. Which artery's pressure point is located on front of upper leg just below the middle of crease of groin? Answer: femoral artery. Question number 7. Where does the partly digested food in brackets in liquid form goes after it leaves stomach? Answer: small intestine. Small intestine. Question number 8. Pelvic fracture can cause severe and even life-threatening bleeding into the A. pelvis areas, B. abdominal cavities. Answer: both A and B. Question number 9. What is the definition of the hurry cases? Answer: any condition that threatens victim's life. Question number 10. What is first aid? Answer: the first help given to the victim of an accident. Question number 11. When communicating with patients, answer: stay at eye level and maintain eye contact. Stay at eye level and maintain eye contact. Question number 12. You have someone who is pale, sweating profusely, trembling and acting aggressively. They appear drunk but do not smell of alcohol. What may be wrong with them? Answer: they are suffering from a diabetic emergency? Question number 13. Which of the following includes the top layers of skin and involve blistering? Answer: second degree burn. So we know the symptoms. First degree burn means redness, second degree is blistering, and third degree charring. So these are the symptoms of first, second and third degree burns. Question number 14. What symptoms are associated with heat exhaustion? A. Cool, moist, pale or flushed skin. B. Rapid, weak pulse. C. Rapid, shallow breathing. Answer: D. All of the above. Question number 15. What is the ratio of compressions to breaths when performing cardiopulmonary resuscitation, in brackets CPR? Answer: 30 compressions is to 2 breaths, 2 rescue breaths. 30 is to 2. Question number 16. The onset of shock in infants and children. Answer: usually results from cardiac problems. Question number 17. Fluid should not be given by dash when internal injury is suspected. Answer: IV injections, intravenous injections. Question number 18. What is fainting? Answer: a brief loss of consciousness. So you must have noticed in the school ground during prayer in hot sun, people used to faint and fall. The moment they fall, they are okay. Okay, so that is called fainting. That is only a brief loss of consciousness. For a fraction of a second, your brain is not getting oxygenized blood. That is fainting. Question number 19. On an infant, if you are the lone rescuer, you should perform compressions. Answer: using 2 fingers just below the nipple line. Question number 20. The symptom of shock includes shock: A. Low blood pressure. B. Rapid shallow breathing. C. Rapid weak pulse. Answer: D. All of the above. So usually we should not allow the patient to go into shock. These symptoms may not appear immediately. It may appear after some time. So all the cases where the shock condition may be in future will come, like severe bleeding, severe burns, diarrhea, severe vomiting, etc. You might as well provide first aid for shock. First aid for shock and to prevent shock is same. Raising the legs, covering the body, and talking to the victim. Okay. So that is all the first aid for shock. You should not allow the patient to go into shock. So if you allow the patient to go into shock, the next stage is death only. So any severe bleeding cases also we provide, do the first aid for shock. Severe burns also, if a lot of body fluid escaped, that time also severe bleeding, severe burns, severe diarrhea, severe vomiting, you raise the legs, cover the body. That's all. Question number 21. What is an open fracture? Answer. A fracture in which the bone is exposed as the skin is broken. So the bone is come out of the skin. That is open fracture. If it is inside the skin, it is closed fracture. Question number 22. If you are the first person to discover the fire, what should you do? Answer. Activate the fire alarm. Question number 23. What is the best way to control bleeding? Answer. Direct pressure. So any severe bleeding, first aid is point number 1, direct pressure. Point number 2, if the bleeding is from the limbs, then you elevate the hand or leg above the level of heart. Number 3, apply indirect pressure. And the last resort is applying tourniquet. So these are the only 4 methods of first aid for severe bleeding. The first one is direct pressure. Apply direct pressure. Question number 24. On an infant, where you check the pulse? Answer. Inside the arm, between the elbow and shoulder. Question number 25. When caring for someone who has suffered an electric shock, you would not. Answer. Check for possible fractures. So you give the first aid for electric shock. Possible fracture, you will not check that time. Fracture can be attended later on. Question number 26. A burn should be immersed or placed under water for at least dash minutes. Answer. 20 minutes. So earlier day they used to say 10 minutes. Later on, some books they said 15 minutes. Presently it is 20 minutes. But the best first aid is, as long as the pain is relieved, until then you can immerse it in water, provided you take care of hypothermia. If it's a large area, body surface area is burnt, then you cannot put him in water for long duration, which will lead to hypothermia. So small area, as long as the pain goes away, you can immerse in water, no issue. Question number 27. What should a casualty with a severe allergy carry at all times? Answer. Adrenaline. It's a drug. Question number 28. When dealing with an unconscious casualty, we should check up to dash for normal breathing. Answer. 10 seconds. So the allowed time for checking the breathing is 10 seconds. Question number 29. What does A stand for in the acronym DRABC? Answer. Airway. Question number 30. How should you open the airway of an unconscious casualty? Answer. Head tilt and chin lift. So with these 30 questions, The EFA MFA set number 3 is complete. You may please support me using this QR code. Okay, this is the book which I published for nautical students and nautical officers, available in Amazon Kindle store for 100 rupees. These are the advertisements of Pondicherry Maritime Academy. You can note down the dates. I strongly recommend you do the courses in Pondicherry Maritime Academy. Pondicherry is a nice place. It was a French colony, also English colony. Okay, a different place in India. And this PME, they have young chief engineers and masters, those who are sailing on leave, they come and take classes here. And the instructors, those who are handling the practical classes, have years of experience. In addition, for every course, they coach you up for appearing for exit exam also. The location is very nice, without any sound pollution, smoke pollution, etc. It's run by a society. The admin staff, the management staff, they were nice people. I always strongly recommend all the people to go to Pondicherry, do your course in Pondicherry Maritime Academy. You can book the courses online. Thank you. Give your feedback in YouTube itself after appearing for exam. How helpful was my YouTube videos? Thank you. Bye until next video.